This will
definitely.
be your last subject for this today.
Oh, yes, doctor. This is the last subject for the day. Professionalism.
You're already exhausted.
Oh, no, no, doctor. No.
Okay, I'll just have to do my share screen. Okay, can you see the slides?
Yes, doc.
Yes, doc.
Okay, so sorry for that technical interruption. Okay, so for this afternoon, our last lecture would be this communication active listening skills by Dr. Alan Junicio. There are so many resources of active listening skills. When you try to look it up in the internet or any other books, but this will be fitting for us because you are medical students and we will be using this all throughout our careers as doctors. So Alan Junicio, for your information, is a family medicine specialist and a counselor, a very good counselor in the Philippines, and he is in UPPGH and UP Manila. Okay, so I will ask somebody, why do patients consult a doctor? So why do you think? Aaron, Aaron Prakash Mani, why do you think the patient will consult with a doctor? Aaron, are you there?
Yes, ma'am.
Okay, so I will ask you, why do you think the patient will sought consult with a doctor?
Uh,
You
illness or
already
problem.
had your PD, right? Your physical diagnosis. Why do you think?
Due to illness or any problem.
Okay, very good. Due to an illness. Another answer? Jostha Ramesh. Jostha.
Yes, ma'am.
Why do you think the patient will consult a doctor?
If he gets certain symptoms of illness and he wanted to get advice from the professionals, so he might consult a doctor, ma'am.
Okay, very good. So I am taking note of your keywords. Thank you, Ramesh, for that. So I was
Thank you,
taking
ma'am.
of the answer by Aaron due to a complaint of a physical symptom, and then Ramesh was talking about having an illness. So let's see. Why do patients consult a doctor? Due to a biomedical reason, and that would be your physical symptoms. So we all know the different symptoms already, like uh, headache, fever, nausea, vomiting, dizziness, chest pain, so on and so forth. So they will uh, go to the clinic to because of those certain symptoms. Or in your histories, it's called the what? Chief complaint, right? So it's a chief complaint. And then they will be they are very concerned with the disease, wherein your disease is the physiological abnormalities that is taking place in the body. So all of the diagnosis and the findings that the doctor is telling you, so that is a disease. And another also, the reason that they are consulting a doctor is due to a psychosocial reason. So, and the anxiety about the physical symptom. For example, Komsan Sumproek came into the clinic and he complained of chest pains. And then, as the medical student in charge of Komsan, while you were talking, Komsan is telling you that aside from the chest pain, Kamsan is already having difficulty in sleeping and doesn't want to eat and is very sad and very depressed. So that is the psychosocial reason. And when you try to do workup with Kamsan, then Kamsan is Or by the way, Comsan, this is just an example, okay? So for example, you're going to diagnose Comsan with a heart disease. So when Comsan learned about the disease, so aside from the physical factors, the symptoms, the depression and anxiety is worse this time. So it's about the illness na. So Ramesh has uh, Ramesh has mentioned about the illness because the illness is about the person's perception, emotions, and experience of the disease. So it will include the suffering and the changes the patient is having, and as well as with the family. So for the learning objectives, we should know the advantage of acquiring active listening skills. Learn the active listening skills and what are those. And at the end of this session, the student will be able to employ bridging tools to build rapport and deepen the interaction. So, aside from the active listening skills, of course, the doctor or the medical student rather should be presentable in facing their patients, or even if teleconsultation is done through online, so we should be presentable, no, we will be not be wearing our sandals or what else, mga boxer shorts or very short shorts or sleeveless, because we are facing with our patients. So active listening skills is developed by a famous psychologist, and that would be Carl Rogers. And why do we need to acquire these skills? So the advantage in acquiring these skills is to develop rapport, wherein it will increase the trust of the patient towards his doctor. So we will make the patient comfortable in sharing even his personal information. So as the doctor, we will enter the world of the client or the patient. So once trust is established, you'll be able to satisfy what you really want to learn from your patients. And then, so after entering the world of the patient, because we see things from the patient's point of view, not the other way around, not the way you want to see it, but with the patient. And then preparation for a working phase of process of counseling. So to pen up and expose emotionally reactive issues and to surface the patient's perceptions of the issues and the manner of dealing with the issues. So it can help eliminate conflict, anger, and resentment. So you are breaking the wall between the patient and the doctor. So it's very good that what you want to learn from the patient and the patient will trust the doctor. It's very good in effective in managing your patient. So active listening skills, it is an effort to listen. It's not just by the patient is talking to you and then you will listen and then finish, but you have to learn these skills. Okay, the first skill that you're going to know is attending. Attending is a non-verbal skill, so there's no words involved in this one, and our body have a way to convey what we are thinking. So this will include body actions and body habits. So for this example, leaning forward, so your body leans forward and then you tilt sometimes your head or you nod while the patient is talking. And then sometimes you could raise your eyebrows, but not in a very arrogant way, no? So girls with pretty eyebrows, be careful of raising your eyebrows. And then you maintain eye contact. So those are positive notes on body actions and body habits when you face your patients. But how about the negative ones? If you try to lean backwards and then you look away from the patient because you are, while the patient is talking and you are using your cell phones, or you are looking at other patients, or looking at the very beautiful nurse or cute doctor that passes by, so it's a negative impression already with the patient on you. And then the distance and location from the patient is very important. So, for example, if the patient comes in to the outpatient department, wherein OPD basis for consultation would only be a table in between you, so the angle or the distance between the patient and the doctor, it should be in a 45-degree angle. So, just picture out an angle with a 45-degree angle. And then it will allow you to have good eye contact and gives the patient option of gazing away from you when he needs to. Sometimes the patient is shy, so they don't want to look directly with the doctor. But you, as the doctor, the listener, you look to your patient. And then on a negative note, if you are too close to the patient, it might threaten them. So, especially for male doctors and their patients are female, if you sit closely to them, you might be they might be threatened them. Or if you are sitting too far away from them, may be interrupted by the patient of the doctor's unwillingness to get involved. So they are thinking the doctor is not interested in me because we are 1 meter in distance or 20 meters in distance. So still it will give you a bad impression, or the patient will give you a bad impression about that. And sitting directly in front of the patient, so um, it's not good also because it will threaten them. As I've said, maintain a 45-degree angle. But if you are in the wards, you have doing your rounds, you can stay at the side of your patient at the bed, no, while your patient is lying down, so you can stay at the sides of the patient. But if you are doing diagnostics, or you are any aside from talking with the patient, and then there's a need for you to um, face forward the patient, then it's a different note already. So that would be your attending skills. Next would be your bracketing. So this time, bracketing is a mental skill. So this is in your mind. So bracketing is setting aside one's feelings, thoughts, and judgments temporarily, so that there will be space in our minds and hearts for what the patient is really saying. So, for example, if the doctor in your class will assign you to a certain patient, and then even if you didn't approach them, you look at them and I don't want that patient. So, say you don't want that patient. So you have to set aside your unwillingness, your being uncomfortable to be with them, because sometimes our view of problem is colored by our biases and prejudices, our preconceived notions about the patient or the situation that he is describing. So sometimes the patient will describe about his life, no, and then, oh, this patient is having 12 children. Maybe he has many boyfriends or girlfriends in the past. So you are already judging them. So set aside of being judgmental, because these tendencies mean that instead of really paying attention to what the patient is saying, we are instead paying attention to our own thoughts and our own feelings. So instead of focusing to your patients, no, you are bracketing your own. So again, set aside that and continue on with your patient. So that would be bracketing. For the third active listening skills would be your leading. So this involves two. You have the indirect lead and the direct lead. So sorry for the background noise of our puppies, no? Anyway, for indirect lead, it is an open invitation for patient to talk about anything that he wishes to talk. So this will allow the patient to lead the conversation. So you'll be using questions like this. So instead of, for example, the patient will approach you for consultation, or in the wards, you would want to ask them about why they were admitted. Instead of saying to your patient, "What is your problem?" to which it will appear strong for the patient, you'll be asking questions like this: what would you like to talk about? Or what can I do for you? And what made you come here to the hospital and be admitted? So that are the favorable questions for indirect lead. And then once the patient is answering you and talking, you can insert words, or you can answer them like, okay, yes, go on, and then, uh-huh. So you can always use that. While for direct leads, the doctor will make judgment to where the conversation should go and ask him to go in that direction. So the patient is talking about everything, what has happened to them. So as a doctor, you'll be the one to make the lead to go directly to where would you the main problem is. So how to know to which direction to lead the conversation is you go towards the feeling that is greatest or intense. So what made the patient really had the most emotion involved, or what really bothered him. So you take note on that, and then you talk about that first, but still you have to pay good attention to other symptoms or other concerns that he is telling you. So example, when the patient comes into you for consultation, the patient would tell you this one: when my chest hurts, I begin to think that I am having a heart attack. And then I become afraid of what might happen to my children if I die. So you have different feelings here. You have chest pain that leads to heart attack. And then if heart attack, it is associated with death. And if you die, you are afraid that what will happen to your children if you are not around anymore. So at least you have four: chest pain, heart attack, death, afraid. And then as the physician, direct lead here is you will choose on what do you think is the most intense for this patient. So as a doctor, you can ask them, what are you afraid might happen to your children? And then this time, the patient will give you all the answers needed for your session for that. Before we will go to another skill, we will have this case study. A 45-year-old male, so you picture this out, okay? A 45-year-old male walks in the office, sits down, then stands up again, and looks out the door to where his wife is sitting. He shuts the door and sits down again. So take note, this patient sits down, then stands up, looks out the door, and then shuts the door and sits down again. So, as you are the medical student in charge of the patient, without saying a word, What does this tell you? Patharanan tuiksakol. Tuiksakol. Patharanan. Please answer. Are you here? Tuiksakol? Can you hear me ba?
Oh, yes, Doctor.
Yes, Doc, we can hear you.
Okay. Is Tuiksakol around? Or does she have a bad connection? Okay, anyway, I'll just call somebody. I'll get back to her. How about Sakchai? Sakchai Yindisarth? Sakchai?
Hello, Doc.
Hello.
Doc,
Are
I'm
you?
Sakshay. Yes.
Hi, you're Sakchai?
Yes.
Okay. Sakchai, what do you think? What can you see about this patient? What can you tell? Just by observing this patient sitting down, standing up, looking at the door, and then sitting down again, shuts the door. What do you think the patient is feeling?
Hello, Doc. The first image I will see the morphology of the patent, the outside for the feeling to stand when the patent aqueduct the pain and and sigh something like that.
Okay. Okay, thank you. Thank you so much. So, this another also, when you are observing this patient, they're full of emotions. If I'm wrong about my observation for this patient, then you can answer anytime. Okay, so seeing this patient is very anxious. She doesn't he doesn't know what to do. He's anxious. So upon for consultation, this patient told you, "Doctor, a month ago, I had this sore throat. So I went to a doctor and he gave me a penicillin for it." So you know antibiotic penicillin. So I took it for 7 days and it went away. But a week later, I had a sore throat again. So while the patient is telling you about his condition, you, as the medical student interviewing the patient, you noted that this patient shifts his seat and looks down at the floor. Then goes on talking to you again. The patient told you that the doctor gave me amoxicillin this time and I took it and the sore throat went away. But a few days ago, again, on your observation, the patient takes his handkerchief and crumples it and pulls at it repeatedly. So, this is a sign of an anxious patient and worried at the same time. The patient told you the sore throat came back. This time, the patient's voice becomes softer and then shakes his head. And then he told you he can't understand what is happening. So aside from anxiety, the patient is very worried and eventually patient is afraid. And sometimes you can um, tell that maybe he's sad about his condition. because he is having sore throat 3 times in a month already, and then he went to doctors and given antibiotics, and then there's no relief. Okay, we will be talking about the next active listening skill, and this is about the case study, and that would be reflecting. So your reflecting active listening skill includes reflecting content, feeling, and experience. So for your reflecting content, the doctor will take the verbal content of what the patient says, repackage and rephrases it so that it becomes clearer, and the doctor will be able to feed it back to the patient. So um, through paraphrasing and perception checking. Okay, so that's the um, that would be how the doctor will learn about to reflect the content of what is the patient's giving to you. So based on what the patient is saying, it's already long, no? He is narrating to you what happened from the very first until the last. Patients who are confused and emotionally pained often struggle to articulate. So, if you could remember the study case, uh, always talking about sore throat and then sore throat again, and then taking medications, then sore throat again. So they have difficulty or struggle even to what is happening to them, and they may say be muddled precisely because of the pain and confusion. They cannot understand anymore why the sore throat is always coming back in spite of the antibiotic. So you have to reflect that content to your patient by example, by paraphrasing. So how to paraphrase that one? So take note that the patient third time already had sore throat. So you'll be saying this one to your patient. This is the third time you had a sore throat within a month, and you can't understand why it keeps coming back. So that is paraphrasing. And then for your perception check, this is used when the doctor is not certain if he understood the patient correctly. So, if perception checking, this is about you. So, meaning the patient has a long story, no? And then, as the doctor or the medical student, you have a difficulty in comprehending with the patient. So, we will check for the perception by asking this one. So, this is the third time you had a sore throat within a month and you can't understand why it keeps coming back. Is that it? And then your patient would tell you, yes, doc. So, if the patient is talking to you in 1,000 words per minute, you, the medical student or the doctor or the listener, will paraphrase it by perception checking into 10 words lang. So, in one sentence. So, that is how to do your perception check. While you're reflecting feeling, so the doctor can articulate the feeling for the patient. And it will be noted that in the clinical case or the study case, that the patient is obviously feeling a lot of emotion. So again, there are many emotions going on with that particular patient. And nowhere does he clearly articulate what those emotions are. So you can tell that the patient is anxious, but actually the patient is not anxious because he is not telling you. So it's like a in TikTok bitaw na tell me you're a doctor without telling me you're a doctor. So how to know one? So you have to do the reflecting feeling. So example, so the feeling this will as I have mentioned that the strongest feeling in this patient is his anxiety or being anxious. So you will be telling him this one. You seem to be quite anxious about your sore throat. So that is how you would reflect feeling for that particular patient. Because helping the patient articulate his feelings serve several therapeutic purposes. So they can give it a name to that feeling and becomes more aware of that emotion, so on and so forth. So that would be your reflecting feeling. And then your third would be your reflecting experience. So in the case, it will be noted that the patient has many gestures. So let's go back to the patient, no? Uh, there are so many gestures for the patient: sitting down, standing up, closing the door, looking at his wife, then sits down again, then shifts his seat, looks down at the floor, takes the handkerchief, crumples and pulls it repeatedly, and shakes his head. Those are the different gestures that the patient is conveying to you. So it will indicate some underlying feeling or perception. Then to have an reflecting experience for that patient is you will be telling this to your patient. I noticed that a while ago you looked out the door at your wife when you shut it. Could you tell me what was behind that action? Then the patient will be silent for a minute, think, and then they will give you the answer. What's the meaning behind that you didn't invite your wife coming into the OPD or inside the clinic? So he left his wife outside the clinic. So the value of reflecting back these nonverbals is that these are often done unconsciously and the patients are not aware what they do them. So by pointing out the nonverbals, the doctor allows the patient to become more aware of how he is behaving. So might as well, he really didn't mean to do it, but because of being anxious, so the patient was shutting his wife outside and didn't invite to come into the clinic. So that would be the reflecting experience. So you know how what's the meaning behind the gesture of that patient. And then the last active listening skill would be your probing. So your probe, these are questions that are asked in order to elicit more information. And then these are the three very important questions that you're going to ask for your patients when you are probing. How does that make you feel? Can you tell me more about that feeling? What is it that makes you feel the way the most? So by adding probes for emotions and inviting the patient to talk about them, it is possible to provide catharsis for the patient and vital information for the doctor about what the perceptions or what are his misperceptions or what are the negative thoughts about having a sore throat. So does he always associate sore throat with cancer or anything else? But this time, you are preparing the patient for a much deeper um, step in communication. That would be your counseling, and we will not be talking about counseling. Okay? So again, um, we, the doctors, are very good in probing because we are asking series of questions that is needed for our, especially in getting the histories. So we are very good in this one, in this area. Like for example, if the patient comes in for sore throat and then, for example, in the emergency room, you see this patient, sir, what seems to be your problem? What is your chief complaint? What makes you come here to the emergency room at this hour? So, doc, I have sore throat. Okay. sore throat, you'll be incorporating the 7 attributes of the symptom. So, when did your sore throat start? So, what are the other associated signs and symptoms? What are the medications for your sore throat? So you have a very um, complete questions to elicit more information about the sore throat. So that is probing. We are very good in that as physicians, as doctors or medical students, because it is vital in our history. But there are also things that we sometimes lack in this probing. That is why we incorporate these 3 questions. So we choose the area to probe and probe where emotional content is greatest. So this time, aside from asking for the 7 attributes of a symptom, you'll be incorporating those questions that is essential to get the emotional content at greatest for the patient. And then, as much as possible, avoid asking with using the word why. Particularly discouraging in the initial phase of counseling, because every time, for example, this is the first time you see the patient, and then the first question you're going to ask with the patient, why are you here? So it is some kind of discouraging in the part of the patient. So again, instead of asking why, what seems to be the problem would be best. Okay, because this encourages the patient to intellectualize right away rather than to get in touch with his feelings. Okay, in summary, for the active listening skills, active listening skills are adjunct to the usual history and physical examination. Adjunct meaning they are add-ons. They even though they are add-ons, they are still essential in getting our usual history and physical examination. Again, if we say it's just history and physical examination, it's a biomedical consult, meaning due to the physical symptom that the patient is coming to you. That's why they are seeking the help of the doctor. But when you incorporate active listening skills with the usual history and physical examination, this consult can become a biopsychosocial one, or biopsychosocial approach, in which we instill this with the medical students, with the medical clerks and the PGIs, because sometimes no some of the doctors now, we are very busy attending to, so we have work left and right, but we tend um to take note on the emotions of our patients. We just want them to um, address their chief complaint, give medications, manage them, prescribe them with, or order them laboratories and diagnostics. But we should incorporate the psychological, social factors, and complex interactions between our patients. So, biopsychosocial approach. And then, scientific medical management, but also compassionate and empathic care. So, you are very perfect. So, you have a very high grade of physical diagnosis, and then you are very perfect with the examinations for your other subjects, and then you have a perfect history taking and physical examination complete from inspection, palpation, percussion, auscultation. But if you fail to be compassionate around with your patient, then it would still be a fail. And then we should practice empathic care for our patients. So empathy is to be in the our patient's shoes. So we should feel what the patient is feeling. So tell me, when you go to the wards na, or you're actually in the battlefield. So battlefield, we are talking about the hospital, the community, and the outpatient setting, or even at home for home visits with our patient. Those are actual battlefields of the doctors. So you tell me if you've never been kanang there's a patient na didn't make you cry, so you can experience that. So you have to be empathy, not just to sympathize, because if you sympathize, okay, okay, sorry for your loss, or sorry that you are sad, that's it. But if you put yourself in the situation of your patient, the more you will help the patient. Okay, so that would be your active listening skills. And before I end this session, I would like you to share this quote. If you just communicate, so meaning you speak, you listen, you can get by of it. So of course we communicate every day. We do that. But if you communicate skillfully, adding those active listening skills like you're attending, probing, bracketing, leading, you can work miracles. Okay, so for that, thank you for listening. Do you have any questions so far? Do you have any questions? Oh, thank you, Doc, from Jitendra Sharma. Thank you, Sharma. I hope you're listening. Okay, so if you do not have any questions, then I will not hold you long.
Doc.
Enjoy. Yes,
Oh,
Diane.
sorry, Doc. My internet was a bit weak, so I couldn't hear what was the problem of the patient of the case study. The internet got stuck and I couldn't hear.
Okay, hold on. Stop first the messages because I cannot hear Diane. Diane, sorry.
Oh, no problem, doctor. I was wondering because my internet was weak, and then when you were talking about the patient case study, I couldn't hear what was his problem. I mean, I saw the symptoms, but then what was his problem? Why did he do that, doc? My internet was choppy, so I couldn't hear you properly.
Okay. Don't you worry, Diane. Anyway, I prepared notes for everybody to study because there's no particular book for active listening skills. So you have your notes already, plus this slides, PowerPoint slides, and I will be uploading that in a few. And the case is in there, so you could refer the case and how to just examples and how to do reflecting skills, content, feeling, and experience. So it's there. So what I'm talking, it's there.
Oh, sure, doctor. Thank you. Thank you so much, doctor.
Okay, okay, so let's end our session. But before that, can we have? Can I do screenshot?
Yes, doctor.
Okay, Diane, can you please do screenshot because I don't know how to take screenshot.
Oh, sure, doctor. I'll
And
take care.
then please send me that to the messenger. To the your private message sa Teams.
Oh, sure, doctor. Of course.
Okay. Okay. Okay, 1, 2, 3. 1, 2, 3, smile.
Oh, doctor. It's
Okay, it's nice to see you smiling, no? Oy, I saw someone making faces. Senedon. Okay.
Sorry, ma'am.
Okay, please send me the picture. And by the way, this is a mixed nationality, right? I saw from India and some of you are from Thai.
Yes, doctor.
Okay,
We
so
have Thai, Indians, Nigerians, Malian doctor, and so far.
before the Thai population in Gulyas um, are just few, but I'm happy that they are already here. We also love Thai. We love your food, and
Yes.
also don't worry. We'll also love Indian food.
Thank you, doctor.
Okay. Okay. Thank you, and have a great weekend.
Oh,
Thank you, Doc.
Thank you, Doc.
Thank you, Doc.
Thank you,
Thank you,
Doc.
Doc.
Thank you,
Thank you,
Doc.
Doc.
Thank you, Doc.
Doc.
Thank you, Doc.
thank you so much.
Thank you, Doc.
Thank you, Doc.